fertility treatments,
Mm-hmm.
it feels like something that's, well, gone from being talked about pretty rarely to being much more visible, doesn't it?
Oh, absolutely. You hear about it more. People seem more open.
Yeah, maybe you've heard someone share their story or just seen it discussed more.
And the data really backs that feeling up. It's not just, a vibe. There's a real shift happening in awareness and experience.
That's exactly what we're diving into today. We're going to unpack what the numbers tell us about fertility treatment use right here in the United States.
Mm-hmm.
We've got a couple of key sources guiding us. There's a big 2023 survey from Pew Research Center. Gives us a fresh look at familiarity, attitudes.
Right, the recent picture.
And we're coupling that with some CDC data. This is from 2017 through 2019. That really zooms in on women's direct experiences with these services.
Yeah, two different angles. So our mission really is to weave these together. We want to understand who's actually using treatments or even just familiar with them and dig into the types of services involved and explore that really critical question. How do Americans feel about insurance covering the costs?
Because cost is huge here.
Always.
And just as a little preview, the picture that emerges shows, well, definitely an increase in familiarity.
Well, sure.
But also some really notable differences across groups and who's most exposed.
Yeah, disparities there.
And a pretty strong public feeling on that insurance question. So let's jump in.
Okay.
Okay, so let's unpack this first big point from the Pew survey. It's just much more common now for Americans to have some kind of personal connection, right? Either they've used treatments or they know someone who has.
Yeah, this is one of the most striking findings, I think. In 2023, it was 42% of U.S. adults reporting this kind of familiarity.
42%, that feels high.
It does. And what's really key is how fast that number changed. Just 5 years before, in 2018, it was 33%.
Wow.
That's almost a 10-point jump. Pretty rapid.
That really does feel like a big cultural shift in a short time. And it's probably worth just pausing here to clarify something you mentioned earlier. The Pew data we're looking at right now, that's the broader familiarity using treatments or knowing someone.
Right. It's a wider net.
Later, we'll get into the CDC data, which is specifically about women's personal use of services, a narrower group.
Exactly. But even this broader familiarity, this 32%, it indicates that fertility treatments are, I guess, becoming less of a niche medical thing.
Yeah.
And more something people just encounter in their own lives, their social circles, their families.
Okay, but here's where it gets really interesting. When you look closer at that Pew data, who is reporting this increased familiarity, because it's definitely not spread evenly.
No, not at all. We see some really clear differences based on demographics.
Okay.
So if you look at race and ethnicity, white adults and Asian adults are significantly more likely to say they or someone they know have used treatments.
What are the numbers there?
It's about 48% for white adults, 45% for Asian adults.
Yeah.
Compare that to just 26% of black adults and around 33% of Hispanic adults.
Wow, that's a pretty stark difference in exposure or reported use. 26% versus nearly 50%.
It really is. A big gap.
And what about gender?
Also a difference. Women are more likely than men to report this familiarity, 47% of women versus 37% of men.
Which maybe isn't totally surprising given the medical side often falls more heavily on women.
True.
But that 10-point gap is still noticeable.
Yeah. But what really jumps out in the Pew survey, I think, is the income difference.
Ah, okay.
Upper income adults are much, much more likely to report having used treatments or knowing someone who has compared to middle and lower income adults.
That income gap seems, well, it points pretty clearly towards cost, doesn't it? The sources mention how expensive things like IVF are.
Exactly. They cite typically $15,000 to $20,000 per IVF cycle.
Ooh, cycle. Oof.
Yeah. And when you put that massive price tag next to the fact that, as the sources note, these treatments often aren't covered by insurance,
right,
it just creates this huge financial barrier. So what this really highlights is how fertility treatment, even though it's getting more visible, kind of functions more like a tiered system based on wealth.
Yeah, less like standard healthcare.
Right. Less like a standard service that's accessible to everyone who needs it.
Okay.
That 15 to 20 grand isn't just a number. For a lot of people, it's basically a locked gate.
Okay, so building on that picture of who's familiar, let's dig into the CDC data now. This is 2017-2019, looking at who actually used services and what kind. And this is specifically women, ages 15 to 44.
Right. So within this specific age group, about 10% of women said they had received some kind of fertility service.
10%.
Yeah. And interestingly, the sources point out that this overall percentage, this 10%, has actually been pretty stable since the early 2000s.
So familiarity is way up, but the actual percentage using any service hasn't changed much in like 2 decades.
Seems that way, which is kind of interesting itself.
Okay, so among that 10% who did get services, who is more likely to be in that group? Any patterns there?
Oh, yeah. Age is a huge factor. Women aged 35 to 44 are much more likely than younger women, those under 35, to have used these services.
Makes sense.
It's 18% for the older group compared to 7% for the younger group. Reflects that biological reality, fertility challenges increasing with age.
And education. Does that play a role like income did in the familiarity data?
It does, yeah. Similar pattern. Women with a bachelor's degree or higher education are more likely to have used fertility services than women with less education. It's 15% versus 9%.
Okay, so even among the women actively seeking help, we're still seeing those kinds of disparities that mirror the broader familiarity picture.
Exactly. Similar dynamics at play.
All right, let's switch focus slightly. For that 10% of women, the ones who did get any fertility service, what specific types of services were they actually getting?
Okay, so the most common thing, by far, was receiving fertility advice. That was reported by 78% of this group.
Just odd advice, consultation.
Pretty much. Next up was fertility testing, 61%. And then drugs to improve ovulation, medications to stimulate egg production. That was 43%.
So advice, testing, basic meds, these seem like the less invasive sort of initial steps.
Exactly. That's the bulk of what people are getting, among those who get anything.
So what about the more complex stuff, the procedures we hear a lot about, like surgery or AI or IVF?
Much less common, even within this group who sought services.
Really?
Yeah. Surgery or drugs for physical issues, tube blockages, endometriosis, fibroids, that was only 11%.
Okay.
Artificial insemination, AI, where sperm is placed directly in the uterus.
14%.
14%. And IVF, in vitro fertilization.
Just 2%.
Wow. Only 2% of the women who are getting any kind of fertility help are actually using IVF.
That feels surprisingly low, doesn't it, given how much attention IVF gets?
It really does seem low. And it kind of highlights that while, advice and initial treatments are more common, those really advanced, often super expensive procedures, they're still accessed by a very, very small percentage, even of those already, on that fertility journey.
And the source clarifies this even more, right? Looking at the prevalence among all women aged 15 to 44, not just those seeking services.
Exactly. Among all women in that age range, only 1.1% have ever received artificial insemination or IVF.
1.1%.
Yeah. Puts it in perspective. Familiarity shooting up, people know about it.
Right.
But the actual direct personal use of these complex, costly procedures, still pretty rare overall.
Which brings us right back to that huge barrier we talked about, cost.
Yep.
So given the expense, given the uneven access, let's look at what the public thinks about health insurance covering these treatments. This is back to the 2023 Pew survey data.
Right. And the majority opinion here is pretty clear. 61% of Americans say health insurance should cover the cost of fertility treatment.
61%, that's a solid majority. What about the rest? Any strong opposition?
Well, 14% say it should not cover it. And then a quarter of adults, 25%, are just unsure.
Okay, so definitely leaning towards coverage.
Significantly, yeah.
Are there differences in who supports coverage across different groups?
Yeah. Yes, we see some maybe predictable patterns again. Women show higher support than men, 64% versus 57%.
Okay.
Adults age 18 to 49, sort of the prime reproductive years, are more likely to support coverage than folks 50 and older.
Makes sense. Politics?
Yep, a divide there too. Democrats and Democratic leaners show greater support than Republicans and Republican leaners. It's 69% versus 54%.
That political split isn't shocking, but I remember seeing something interesting in the sources about the split within the Republican group.
Yes. That is really interesting. Republican women are notably more likely than Republican men to say insurance should cover these treatments. It's 60% of Republican women compared to 49% of Republican men.
60 versus 49, that's a pretty big gap within the same party.
It is. Suggests this isn't just a straight party line issue for everyone. Personal experience and perspective might be playing a role there.
So, strong public opinion that insurance should cover it. But what about the reality? Did the CDC data touch on actual coverage for those who got services?
It did offer one data point on that. Among the women who received fertility services back in that 2017-2019 period, 70% said private insurance did cover their treatment.
70% had coverage.
For some part of their treatment, presumably. So coverage is definitely a reality for many, but clearly not all.
Right. And the public seems to feel it should be more universal, especially given those high costs we keep coming back to.
Precisely.
Okay, so let's try and wrap this up. What does this all mean when you put it together?
Well, we've seen Americans are definitely becoming much more familiar with fertility treatments. They're encountering them more, talking about them more.
Yeah, awareness is up.
But we've also uncovered how that familiarity and the actual use of services isn't evenly spread out. It's more common among certain racial, ethnic, gender, income, age, and education groups.
Often linked back to cost and access.
Very much so. And we saw that the vast majority of fertility services people actually get are things like advice, testing, basic meds.
Right, the initial stuff.
While the complex, expensive procedures like IVF, still used by only a tiny fraction of women overall.
And finally, there's that strong public support, a majority view, that insurance should be covering these costs, even if the reality isn't quite there for everyone yet.
Exactly. So these findings, they really paint this picture of a complex, evolving landscape around family building in the U.S. It highlights, increasing visibility, maybe increasing need, but also these really significant questions around equity, access, and the role our healthcare systems play, or maybe should play, in supporting people facing these challenges.
So thinking about all that, the high costs, those clear demographic gaps in who uses treatments or even knows someone who has, and then the strong public feeling that insurance should pay for it. What does that whole picture suggest to you about the future of equitable access to these family building technologies in the U.S.?
It definitely raises an important question for you, the listener,